Dental health to me is really important because at the end of the day, dental disease leads to so many other issues. The bacteria that gets into the gums, gets into the bloodstream, goes to the liver, goes to the kidneys, goes to the heart. Therefore, if we have some underlying conditions, dental disease can actually progress, and even in healthy animals, if the dental disease is severe enough, it actually can start contributing to those actual issues. Abscessation in our pet's teeth are either one from chronic dental disease that has led to issues beneath the gum line, or due to fractures with the actual teeth that therefore bacteria wicks its way up through the pulp chamber, leading to abscessation.
It's fairly common, and it is a disease that I see fairly regularly in both dogs and cats. Arguably sometimes a little bit more in cats, just because they go so much longer between going to the veterinarian for any services. Seeing as we do see a lot of dogs as well, majority of my patients over 5 years old do have some degree of dental disease, unless they are regularly coming in for their dental cleanings. So the number one thing is definitely bad breath. I have owners who say the breath is so bad that the dog couldn't sleep with them that night. And usually that's going to be our first step in, okay, well then let's see what's going on in the mouth and make sure that this isn't due to some degree of dental disease. Other things are going to be not wanting to eat quite as voraciously because the mouth hurts, or decrease in activity because they're in pain or uncomfortable or not feeling well. When we do have abscesses, it's definitely the only way to really cure that condition, or at least treat that condition, is going to be to remove the affecting teeth.
Dental cleanings are sedative procedures, so we do have to sedate them. So what is included is all of our pre-anesthetic drugs, our catheters, fluids, and then on top of that, it's the actual cleaning. So when we do clean the teeth, we do use an ultrasonic scaler to help clean the tartar off. We probe, we look for any issues beneath the gum line, and we polish the teeth to try and prevent any of the scratches and nicks, causing footholds for tartar to build up a lot faster.
Ideally, if they can brush their dog's teeth twice a day, especially morning and night, just like most people, that would be great. But of course, most dogs and cats are not going to allow us to do those things. If we can get an owner to brush at least 1 to 3 times a week, that's definitely going to be better than just leaving things to just proliferate on their own. While some breeds and some sizes may be seen a little bit more frequently, it doesn't mean that everyone is exempt. Hence why we recommend at least once a yearly cleanings, if not every 18 months.